Hello everyone, welcome back to my YouTube channel that is Nursing Tricks. I hope you all are doing well, and if you have not subscribed my channel, please do subscribe my channel and hit the bell icon to get the latest notification from my channel. And this particular video is all about respiratory tract infection, and you have seen our previous videos in which we had already done the bronchiolitis, and this video is about pneumonia. And make sure that this video is not the official teaching, it is just an informational teaching. You can add these notes into your notes, and these notes are made by me from the various books I have preferred. So let us start with the pneumonia. So first of all, let us see that what all things we will see in this particular video. We will see the definition of pneumonia, and we will see the classification, and then we will see the etiology. And here I would like to add that in your various exams, when you will appear, you will see that this particular question is a very important question, and I have also seen this question many a times in the subjective papers as well as in the objective question papers. So make sure that the things which I am teaching you, that you should read these things from the books as well. So etiology, and then we will see the clinical features, and then the diagnostic evaluation, and then we will see the treatment part, and the very important thing, that is the nursing management of pneumonia. So let's start with the definition. Okay, so let us just start with the definition. So the word pneumonia, if you will define this word says that it is a consolidation. Now what does this word mean, consolidation? Here, just to remember that whenever you are writing a definition of pneumonia, this word should be there in your definition. Why? Because this word itself defines this particular term. The consolidation means that when it is a process in which two or more things come together to form a solid thing. Okay, so here I have defined this word, which is consolidation, in which here you can see in this particular word, the word solid is here. So the solid word means that something solid is there, something solid is getting formed in your lungs, which is leading to this particular pneumonia. Okay, so let us write the exact definition of pneumonia. It is the process in which there is a consolidation. And now if you will see where this consolidation is taking place, the consolidation is of the alveoli. So the consolidation of alveoli, in one word if you have to define, it is known as the pneumonia. Or you can say there is a infiltration of interstitial tissue along with the inflammatory process. Now why this inflammation is taking place in the lungs? This we will see in the etiology, that what is happening inside the lung which is leading to this particular process, which is known as the inflammation, inflammatory cells, or both. Now if I have to say the definition in a one go, then Pneumonia is a process in which there is a consolidation of the alveoli, or there is an infiltration of the interstitial tissues along with the inflammatory cells, or there can be both the things which are happening together. So this particular word, which is consolidation, it should be there in your definition in order to complete the definition of the pneumonia. I hope the definition is clear to you. Okay, now let us just see the classification. Very important, classification of pneumonia. Okay, so now we will see the classification of the pneumonia. So now the classification of the pneumonia, if you have to classify the pneumonia, you can classify it into based on the basis of the morphology. Morphologically you can classify. Now what is morphology? Anatomically also you can classify. The other substitute word for this is anatomically, or you can classify it on the basis of the causative organism or the etiology of the pneumonia. So if I have to classify it on the basis of the morphology, I will classify it into number 1, it can be lobar, it can be broncho, and it can be interstitial. So if I have to classify it on to the basis of the morphology, it can be lobar pneumonia, it can be bronchopneumonia, or it can be interstitial pneumonia. Now what is the lobar pneumonia? All or a large segment, you can say all the segments or the large segments of the lung is involved in this process. It is a lobar pneumonia. In the bronchopneumonia, it begins in the terminal bronchioles. Here you can see it is attached like this. Either it can be here, or it also engorge the other alveoli, which can clog the alveoli with the mucopurulent exudate. So this is the bronchopneumonia. And the interstitial pneumonia, it is the inflammatory process which is more or less confined within the alveolar cells only. So here if I have to explain you in a one word, in this particular pneumonia the lobes are involved, in this particular pneumonia the terminal bronchioles are also involved, but in this particular pneumonia only and only the alveoli are involved in the process. I hope this much is clear to you. And if you have to write, let me just say what you will write in the lobar pneumonia. In the lobar you will write all or the large segment of your this lungs, they are involved. In the bronchopneumonia, it begins in the terminal bronchioles and which become clogged with the mucopurulent exudate. And then in the interstitial pneumonia, it is an inflammatory process which is more or less confined within the alveolar walls. Okay, and it is also known as the interstitium pneumonia. Okay, now let us just move on to the etiology, and it is the very commonly we have seen that the pneumonia, if you will see, it is being classified onto the basis of the etiology. So if I have to explain that on the basis of etiology, it is divided into the viral pneumonia, then bacterial pneumonia, viral pneumonia, bacterial pneumonia, mycoplasmal pneumonia, and then the aspiration pneumonia. Just to add on to your notes, you can just make this diagram. This is tracheae, this is your bronchioles, and here you can make the lungs. and here let me divide. If these entire lobes are involved, this is lower, and if only the bronchioles are involved, it is broncho, and then if the only this much, or you can say the alveoli are involved, it is interstitial. Okay, so this is for this anatomical. Okay, so we were on to the etiological part. So we have seen that it can be classified onto the viral pneumonia, bacterial pneumonia, mycoplasmal pneumonia, and the aspirational pneumonia. Okay, so this is the classification. Now we will see in detail that what all viruses are responsible for making this pneumonia, or bacteria are responsible, mycoplasma and the aspiration. So let's get started with the etiology. So in etiology, first we will see the viral pneumonia. Okay, let me just rub it. Okay, so here we will see on the basis of the etiology, we have seen that it can be caused by the virus. So in the viral pneumonia, in this we will just see that what all viruses are responsible. In details we will see when we will study about the various types of pneumonia, that what is the clinical feature and how you will differentiate the various types of pneumonia from the other ones, and what are the treatment, what is the nursing management, and all we will see when we will deal with the types of pneumonia. So here let us just see that what all viruses are responsible for the viral pneumonia. So the very important, please make a star on it, that is RSV, which stands for the respiratory syncytial virus. This is the virus which is responsible for the pneumonia. And here to just add on to your knowledge, that we have seen the name of this virus somewhere else also. So this virus is also responsible for causing the bronchiolitis. If you have seen my previous video, you will see there also I have told you that RSV is also responsible for the bronchiolitis. So here if you will see, this is also responsible for the process of pneumonia. Okay, and the second one is the influenza. In this, the adenovirus, in this particular category we have adenovirus which is responsible for it. Then we have parainfluenza virus, and the third one is the influenza virus. So here if someone asks you that what all viruses are responsible for the pneumonia, so you should first take the name of the respiratory syncytial virus immediately, and then you should also say that influenza virus is also responsible for the process of pneumonia, in which we include the adenovirus and the parainfluenza virus. So I hope the viral pneumonia is clear to you. Only and only the names of the pneumonia I have mentioned here. Don't worry, we will see the management, the definition, everything once we will deal with the types of pneumonia. Okay, now next one is the if you will remember, that second name which I have written was the bacterial pneumonia. Now let us just see what all bacteria are responsible for this pneumonia. So first let me just tell you that in this, if you will see, in the age group of 0 to 1 years, that is infancy, let us just divide so that we can just remember the names of bacteria. If we have to just mark the answer that in infancy which all bacteria are responsible, in this particular age group which bacteria is responsible, so I have just categorized it into the infancy, and then to the till 2 months of age, and then 3 months to 3 years, and then after 3 years. Then after the 3 years. So this way we can classify, just to memorize. Okay. So in infancy, it is the gram negative bacteria which is responsible for having pneumonia in the infants. Now, not only the gram negative bacteria, we can say if the infant is malnourished, not malnourished, we can say the severe malnutrition, or if the child is having the immunocompromised state, these two factors can precipitate the pneumonia. So along with the gram negative bacteria, if the child is having the severe malnutrition or if the child is immunocompromised, it can lead to the pneumonia in infancy. Okay. Now in 2 months, so let us just see, in the 2 months, it is the gram negative bacteria and also the gram positive bacteria. Now let us just see that what all gram negative bacteria are responsible and what all gram positive bacteria are responsible. Here very important, you have to see in the stem that whether they are asking you about the gram negative or the gram positive, because you will see in the key that the gram negative and gram positive both will be written, and it's only and only your eyes that if you have seen the gram negative, if you will mark the correct answer, you will get the marks, otherwise you will go into the negative. Okay, so the gram negative bacteria, can you name the gram negative bacteria? Yes, we can. That is the Klebsiella and the E. coli. Klebsiella and E. coli, which is responsible for the pneumonia. And then in the gram positive, if you will see, it is pneumococci. And then second one is the staphylococci. I am not rushing through this because I know once you will be in the exam, you will see, you can mark my line that definitely you will see this particular question if you are going for this subjective exam. So please make sure that you should see and you should write all these things, then only you will get the proper marks. Okay, so gram negative and gram positive. In gram negative we have the Klebsiella and we have the E. coli, and in the gram positive we have the pneumococci and the staphylococci. Okay, so these two are the organisms. Now let us just see in the 3 months to 3 years. So here you can see the gram negative. Here I have not mentioned, so you can just write from here. Okay, in 3 months to 3 years we have streptococci pneumoniae, and then we have Haemophilus influenzae, and lastly we have staphylococci. So streptococci, Haemophilus and the staphylococci, these are the responsible for causing pneumonia in the age group of 3 months to 3 years of age. And after 3 years of age, here we have pneumococci, and we have the staphylococci. Okay, so here we have seen that various organisms are responsible for causing the pneumonia in the various age groups. This you have to learn, that which all gram negative organisms and which all gram positive organisms are responsible in which all age group. In infancy, if the question is asking for the infancy, it's the gram negative bacteria or the gram positive bacteria, but make sure that the severe malnutrition or the immunocompromised state is they are precipitating this particular disease. And in the 2 months, the gram negative bacteria are the Klebsiella and E. coli. The gram positive bacteria are pneumococci and staphylococci. In 3 months to 3 years of age group, it is streptococci pneumoniae and the Haemophilus influenza and also the staphylococci. And after 3 years of age group, if the pneumonia is there in a child, we can say it can be because of the pneumococci or the staphylococci. Okay, now let's see the atypical pneumonia. So this atypical pneumonia, it is caused. Now what is atypical pneumonia? Here if I have to just write what is atypical pneumonia. So atypical, so you have seen that many a times we use a word typical. Typical means when the thing or the particular disease is caused by, or you can say the most common or causative organism. That is a typically we can say this particular organism is responsible for causing this particular disease. But atypical is, that is you can say, which is caused by the bacteria other than the common ones. So this is not caused by the common bacteria, but yes, this is also caused by the bacteria only, but they are not common ones. I hope you are getting. So next is atypical. In atypical we have the mycoplasma and we have the chlamydia. The mycoplasma and the chlamydia. So this mycoplasma and this chlamydia, you can say they are the community acquired pneumonia, and they can be responsible for causing the pneumonia in the adults as well as in the children. So mycoplasma and chlamydia, here you can just write a small word which is community in order to remember. If you will, once you will go through your notes, that why this I have written this. So this is the community acquired pneumonia, which is responsible for causing pneumonia in the adults and the children. Now very important, you must have seen this name, Pneumocystis xerovesi, Pneumocystis xerovesi, and the histoplasmosis and the coccidomycosis. Here to add, I have seen this question that out of these organism, which organism is responsible for causing the pneumonia in the immunocompromised children. So in that particular question, this coccidomycosis was there, and that was the correct answer to that particular question. So this is the way how you will get the questions out of these particular topics. So make sure that once you are making your notes, just mark a star or whatever you want to mark, you can in front of it, that what all things are important and we have to remember them. So coccidomycosis, histoplasmosis and Pneumocystis xerovesi, you will see that they cause the pneumonia in the immunocompromised children. Immunocompromised children. Okay, so you can see that in these children, these organisms can easily cause pneumonia in the children. So I hope this atypical pneumonia is clear to you. The mycoplasma, chlamydia, which is more commonly community acquired pneumonias, and the Pneumocystis xerovesi, histoplasmosis and coccidomycosis, they are responsible for causing the pneumonia in the immunocompromised children. Okay, now let us move on to the next etiological type, which is your aspiration pneumonia. So aspiration pneumonia, the word itself is telling which is caused by the aspiration of it can be of liquid paraffin, it can be of kerosene, or can be poisoning also. So just let me write it, aspiration pneumonia, which can be caused because of the aspiration of the liquid paraffin. If they will this particular substance will go into your lungs, it can lead to the pneumonia. Kerosene, they all are the foreign things to the lungs. So in order or in response to the foreign things, the lungs will respond to the consolidation as a consolidation, and the consolidation word is defining the pneumonia. So this way the aspiration pneumonia takes place, or it can be the poisoning. Okay, so these are the various things which can lead to the aspiration pneumonia. And the last thing in etiology, just to write that in about 1/3 of the cases the etiology is unknown. In about 1/3 of the cases the etiology is unknown in the pneumonia. Okay, so this was all about the etiology. Just to revise, we have seen the viral pneumonia, the bacterial pneumonia, the atypical one, and then we have seen lastly the aspiration pneumonia. In the viral we have seen the RSV and the influenza one, and in the bacterial we have seen in the infancy, in 2 months, in 3 months, then 3 months to 3 years, and up more than 3 years. So in atypical we have seen the thing that we have to remember is the mycoplasma, and this is community based. And then we have seen your coccidomycosis, histoplasmosis. They are responsible for causing the pneumonia in immunocompromised, or you can say they are the opportunistic infection in the children with the immunocompromised state. And then in the aspiration we have seen that aspiration of the kerosene or liquid paraffin or the poisoning lead to the aspiration pneumonia. So done with the etiology. Now let us just move to the clinical features. So let us just move to the clinical features of pneumonia. So the clinical features. I hope you are clear till here. If you have any doubts, you can just write in the comment box. I will try my best to clear your doubts. Next is the clinical features. So now before starting off with the clinical features, there are some risk factors which can precipitate to the pneumonia. So what are those risk factors? The risk factors are as follows. First one is the low birth weight. If the child or if a newborn is having a low birth weight, so we can say the child will have severe malnutrition, or it can child may have immunocompromised state. So we have seen in the previous when we have studied the classification, there we have seen that these two things can precipitate to the pneumonia. Then malnutrition we have already seen. Yes. Then very important to note, deficiency of which vitamin can lead to the pneumonia. So it is vitamin A. And why? Because vitamin A is responsible for the epithelial cell regeneration. It is responsible for the epithelial cell regeneration, and if there is the deficiency of this particular vitamin, it can lead to the pneumonia. Okay, then next is the lack of breastfeeding. The breastfeeding is, it is the optimum, or you can say the best nutrition for the child. So lack of breastfeeding, if it is there, can lead to this. Or there is a passive smoking, or if there is a passive smoking, or if there is a large family size can also lead to this. Or if there is any family history, can lead to this. Or if there is a advanced birth order. In advanced birth order, what will happen? The child will not get the optimum nutrition. If there is a overcrowding in the family, you can say the crowding in the family. Or if it is a young age, or air pollution, you can write air pollution. So these things can precipitate to the pneumonia. And indoor air pollution, it is also one of the major risk factor for the acute respiratory tract infection, and this happens in a developing countries, and we know our country is also a developing country. So also you can add on to the indoor air pollution. Okay, so now let us just see that what is the onset of this particular disease, and what all clinical features we can see in the acute phase or in the other phases. I hope you have written this. So let us just see what all things we can see in the onset. The onset is, it can be insidious. Now what is insidious? The insidious onset means which is having a gradual proceeding, or you can say the subtle proceeding, but the effects are harmful. The effects are harmful. So the onset of this particular disease is insidious, and it starts, mark this line, starts with upper respiratory infection only. It doesn't mean that if it is a lower tract respiratory infection that it will show the symptoms of lower respiratory tract only. It can show the symptoms of the upper respiratory tract infection also. Okay, so this is the onset. We have seen about the onset of this particular disease. Now if there is a acute onset of this particular disease, we will see the high grade fever, and then we will see the dyspnea, we will see the grunting, respiration will be there. Dyspnea is the difficult breathing, grunting respiration, difficult breathing, and then grunting respiration. And mark the line, the respiratory rate will always be increased. Respiratory rate is always increased in this particular onset, that is acute onset. Okay, so I hope this much is clear to you. Now very important thing that I am going to write onto the board, please mark this line, that many a times you will find that child will come with the acute abdominal pain or acute abdominal emergency. There we have to also make a diagnosis of the pneumonia by acute abdominal emergency. So in acute abdominal emergency we can suspect pneumonia. Why? Because this is your lungs, these are the pleura, outermost covering. So the pain comes from the pleura and it goes on to the abdomen, which is known as the referred pain. So we can have a child with acute abdominal emergency because of the referred pain from the pleura, and also if there is a apical pneumonia, it can be associated with the meningismus and the convulsions. But if you will go for the CSF examination, the CSF is clear in that, and the apical pneumonia is in which the apex of the lung is involved, and it is caused by the Mycobacterium tuberculosis and the pneumocystis xerovaccae. So where we have heard this word before, pneumocystis xerovaccae, it is responsible for causing the pneumonia in the immunocompromised child. So till here we have seen, just you can say just we have introduced the term pneumonia. We have seen common classification, we have seen the clinical features, we have seen the what all are the risk factors, what all bacteria are responsible, what all viruses are responsible for having this particular disease. And in the next video I will be dealing in detail with the pneumococcal pneumonia, staphylococcal, hemophilus pneumonia, and there you will see the treatment is it is you will see the different for the different types of pneumonia. So this video is till here only. In the next video you will see the various types. So I hope you have liked the video. If you have not subscribed my channel, please do subscribe my channel and hit the bell icon so that you will get the notification for the upcoming videos. So if you have any doubt till here, you can leave your questions in the comment box, or else if you want to write something or you want me to improve in something, you can write in the comment box. So this is all about the introductory part of the pneumonia. Thank you so much.